Hello, my name is Laura Wiggs, and today we're going to be talking about tips for navigating the healthcare system. With that said, there's a disclaimer. The information in this presentation in either written or verbal form does not constitute legal or medical advice, just friendly tips. And these are the objectives. These are some of the things. Healthcare today is tough to manage and figure out where you need to go, what you need to do. And so the objectives for today are to help you understand or have a better idea about how to do that. So those are some of the things we're going to go over. So the first thing that you need to remember when you are talking about navigating a healthcare system is you are a consumer, okay? So you need to be informed. You need to do your homework. You need to have an idea about what your benefits are or are not, how you can get health care, okay? You need to research and understand any of the diagnosis that you have been given, okay? There's a lot that goes into this in order to really be effective at managing your own health care. You want to make sure that you are asking questions of everyone, of your healthcare provider. Ask them to make sure that they're explaining things to you, why they're doing what they're doing to you, okay? Don't hesitate to also ask questions of your insurance company or Medicare and Medicaid. And be meticulous at looking at the billing. With all of that too, as a consumer, you need to expect that you will get answers. It's not okay for someone to just say, I'm going to continue to pass you up the chain and you never to get an answer, okay? So sometimes you have to really kind of dig your heels in and say, I need to have an answer. So the first thing I want to go over are the different types of healthcare coverage that are out there. So there's Medicare and there's Medicaid. HMO, which is a health maintenance organization, and if you have this, you need to stay in your network. You need a referral from your primary care physician to go see a specialist. The advantage is you have a lower premium and a lower deductible, okay? Then there is a PPO, which is a preferred provider organization. And with that, you have a much larger network to choose from. You do not need a referral. You can go out of your network. However, you have a higher deductible and a higher premium. So these are some of the things that you need to think about when you are selecting your health insurance if you have that as an option. You then have what are called your high deductible health plan. These have much, much lower premiums. Okay. However, you have a very high deductible when it comes down to it. So if you are in good health, this is potentially an option for you. There is also an EPO, or an exclusive provider organization. You do not need a referral. You have to stay in network, and they have a very limited network. And there are a couple of these in Houston. And then the final one is concierge medicine. And this is where you pay the provider directly. You do not have insurance. So those are some of the options for healthcare coverage. You need to know what coverage you have, what is and is not covered, okay? From an insurance standpoint, you want to always take your insurance card to your appointments. That's going to be one of the first things they ask you for. And if you don't have your insurance card and you don't have that information, you can be pretty well guaranteed that they will not ask you to go ahead and come on back and see the physician or the healthcare provider. You need to know your copay and your deductible, okay? There's a lot of times where there are mistakes made on that up front, so make sure that you are aware of that. Be consumer savvy, okay? You can call your insurance before the appointment to verify that a particular provider is in network. This happens very frequently where a physician might refer someone to a particular provider because they say, this is who I would refer my family member to. That's fantastic. We go there, and then we find out that this individual is not on our plan. Okay, so find all of that out before you go and verify what your copay will be. Okay. Know which emergency centers are in your network, and that will help you avoid large out-of-network bills. If you go to an emergency center that is not in your network, you can then be hit with a bill for many, many thousands of dollars more. You want to understand how to work with your insurance or your third-party payer. Okay? You want to make sure if you have a conversation with someone from the insurance or Medicare or Medicaid, that you take notes. You need to have a date, the time, and the name of the individual that you spoke with, okay, for every interaction. If there is a denial, the denial has to be sent to you in writing, okay? The other thing is you can also, and you should, ask for your insurance representative to, as we say, quote unquote, walk you through the denial. You want to know exactly why you were denied. So the next thing that you need to know or have is what we call a portable health record. And basically what this is you having a summary of your medical record, of your health. Okay. It's a way for you to manage your health information. It's a way to consolidate everything. You see someone in one system, then you go to another system, but those aren't connected. This is a great way to have all that connect. It is a very easy way for you to, especially if you're going to see a new provider, to be able to say, here's my information, and it is a quick summary. And it is also quite nice if you can sum it up enough that in case there is an emergency, it's a one-pager that you can hand to somebody, EMS or someone in the emergency room, so that they have good and reliable information about your health. So there are a lot of types of portable healthcare records. There are many these days that are web-based. There are some that are web-based, based on a bracelet. You can buy have a bracelet and it has a number on there. In the event of an emergency, they can call the number and access your information. You can also go old school if that's not for you, and you can keep a 3-ring notebook. And that works just as well. You can do this on your computer in different files. The thing about doing this on a computer is if you go into your physician's office, you want to make sure that it is easy to pull up. You don't want anything that is going to be difficult for them to pull up and go through, okay? If you have a medical condition or diagnosis or taking any medications, at a minimum, in your wallet, you should carry a list of your diagnoses, the medications that you are taking, and your emergency contact information. Okay. So what other information should be in a portable healthcare record? Well, the obvious ones, of course, are name, date of birth, allergies, current medications, your medical history, your physicians and other healthcare providers involved in your care, your advanced directives, immunizations, and a date of the last kind of what we say basic test, right? How many times you go to see your primary care physician and they say things like, well, when was the date of your last mammogram or your last, PSA test? So instead of having to constantly go back and count the number of years, have all that information in one place so that you can easily provide that to your primary care physician. Now, when it comes to medications, you have to have a current and an updated list of all of them. And you need to have not just the name of the medication, but also the dose and the frequency. You also want to have the name of the physician who prescribed that medication and why. There are a lot of medications that are not used for their primary use. For example, gabapentin or Neurontin's primary use is a seizure medication. However, a lot of individuals use this not for seizures, or seizure prevention, but for pain, nerve pain. So you want to make sure that you have the why you were prescribed that medication on there as well. You need to include all vitamins and supplements. Frequently, people do not list these under their medications. The reason this is important is that there are many of these vitamins or supplements or combinations of supplements that can actually have interactions with the medications that you are taking. So with your allergies, it's important to list not just your medication allergies, but also your food and environmental allergies. For example, you want to make very clear if you have a latex allergy if you are going into the hospital. You also want to make sure that you list medication sensitivity. So this is not a full-blown reaction, but someone who is very sensitive to certain classes or groups of medications. So for example, if you're going to go in for surgery and you know that you didn't wake up very quickly after the last time you had anesthesia, you want to share that information with the physician before you go in for surgery. Now, your medical history doesn't have to be tremendously detailed. Obviously, if we're trying to keep this down to just a page or two, right? But your medical history should just list off all of your previous surgeries or big procedures and your diagnoses. And it needs to be or should be in a chronological order. So that, for example, when the physician looks at it, they say, oh, in 1998, you had a left wrist fracture. In 2000, you were diagnosed with type 2 diabetes, and this is the physician who's managing that or has been managing that. In 2012, you were diagnosed with hypertension. So it gives a very quick story about what your own personal medical history is. You should also have in there, if you have legal information. So if you have an advance directive, which is essentially a legal document that allows you to state what your wishes are for how your health care is being managed if you are unable to actually tell somebody that. So you've thought about this before, you know how you want your medical information to be managed, okay? You could also have a medical power of attorney. If you have either one of those, you need to make sure that this is something that is in there in your medical profile, and that when you go to the physician that they have that, okay? There is a lot more information on the internet on this, and so there are actually downloadable forms from the Texas Department of Aging and Disability Services website if you guys are interested in that. So it's dads.state.texas.us, and so there's already those forms on there, easy to fill out, and you can take those with you to the physician that you're going to see, and they can put that in your record. Regarding your immunizations, this is basically just your updated shot records, okay? So when was the last time you had a flu shot? When did you have your tetanus shot? Because you don't need to have a tetanus shot every year. So these are things that are important to have on there. You want to have a very good listing of your current healthcare providers. Who are the physicians that are managing your care, and what are their specialty areas? Are there other healthcare providers who aren't medical physicians involved in your care? For example, are you at this point having to regularly see your dentist, a physician assistant, pharmacist? Do you have a therapist, an OTPT, speech therapist? Are you seeing a chiropractor, a nurse practitioner, or a mental health professional? So a complete listing of everyone that is involved in your care. So the next thing is if you have to change, right? A lot of these healthcare plans change frequently, and you've been going to the same physician for many years, you like them, and suddenly they're not on your plan anymore. So how do you go about picking a healthcare provider? Research, 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 okay? I would highly recommend asking your current physician who they would recommend or refer you to. Ask your friends, hey, do you have a physician that you like? Or do you have a physician you want to stay away from? Or do you have a therapist that you like, or one that you would say, don't go there, okay? Look up your healthcare provider on the internet, and the internet can be a dangerous thing. Remember that when you look at those reviews, Typically, those reviews are either going to be the glowing reviews where they had a fantastic experience or something went wrong, and that review's not going to be great. So look at those, and of course, if you have someone who has a lot of complaints, that would not be someone you should pick. You want to make sure, the other thing you can do is ask your insurance company, including Medicare and Medicaid, to give you what they call a care manager, and they can assist you with recommendations. And so when the data that they keep are on physicians or providers, other healthcare providers who have good outcomes. And so that's a great way to get some names to be able to go in and say, let me research that a little bit more. Remember that you can always get a second opinion. And this is especially if you're going in for something that is a specialty area. And if you get in there and it's just you're not comfortable with things, you can always get a second opinion, okay? You want to ask your healthcare providers what their outcome data is, okay? What are your outcomes like? Do you have good outcomes? Can they quote you some of their outcomes? The next thing you want to think about when you go to see a healthcare provider is how to communicate effectively. The better you can communicate with your healthcare professional, the easier it's going to be for them to determine how best to treat or manage your issue, okay? You want to practice before you go, using a concise yet thorough explanation of your problem or issue. So this can be, I highly recommend that you write these things down first, and then you practice how you're actually going to say it. While a lot of us, myself included, like to give a good story with things, that is not, that things get lost in that, in the storytelling. You want to be very precise and say, these are my issues, or this is my problem, okay? You want to say, what are my symptoms? What makes them worse? Is there anything that makes them better? Keep a log. If this is something that's been going on for a while, say, oh, I have this back pain and it's every single time I turn this way. That is helpful information to the healthcare provider. When did it start? How long has this been going on? You know, oh, I think maybe 9 months. Not a good answer. Started noticing this in May, and it's become consistently worse over the last 2 months. That is a much better way of giving information, okay? And then the other thing is you have to be honest with your healthcare provider, all right? They are asking you questions, and they want, in order for them to best manage your case, they need to have all the pieces of the puzzle. So if you are a heavy alcohol consumer, or if you are using recreational drugs, those are things that they need to know about in order to provide you with the best possible care. All right, our guest for today is Anna Tovar, and Anna has experienced the healthcare system from the perspective of a mom of a brain injury survivor.
Correct.
Was brain injury survivor herself.
Correct.
And also works and manages a very busy physician's office. Anna, one of the things we've talked about is how do you effectively communicate with your healthcare provider?
I think that one of the hardest things is finding, first of all, the right provider. Be it a referral from the hospital or just looking, online, whomever it is. The most important part is the first office visit. You have to explain to them exactly what your family member has, their priorities. If it's someone that is wheelchair bound and it's going to be difficult coming into the office, a referral to go see another physician, you know that you're going to need that. What's the purpose of coming in if you know the history of this patient? There's physicians out there that'll work with you. Okay, a lot of it is how you come across as well as how they receive it. So it's a little bit of, you have to go an extra step to get this physician. Once you get it, I was blessed. I told the doctor, he saw my son. I don't want it to be difficult every time he needs something. I mean, granted, there's times when he will have to come in. We all understand that. But there's times where it can just be done over the phone. The labs, he's not feeling very well, something, UTI, whatever, and get that. He can give the order over the phone. Those are simple things. You want to keep it as simple and as light for the family.
Okay. So how did you go about setting that up initially? How did you develop that rapport with this physician?
Exactly that way. In my case with my son, he was assigned a physician through the insurance because it had to be an HMO at the time. Okay. We got the physician. That particular practice was very hard to even make an appointment. And in my case, it happened where we ended up going to the ER. They assigned one of the attending physicians who had his practice, who a lot now don't, which makes it even harder. We saw that physician there, or he saw him there in the hospital, and then I made the follow-up appointment. I kept him because we were able to communicate with the physician. You get to know the staff. Sometimes, again, it's the extra steps that you have to take. I took a lot of extra steps.
So when you say extra steps, enlighten us.
This is me. Send a thank you card. Okay. When your family member's asleep, take that moment, you know what, that doctor was really good, or the office staff was really good. Send a thank you card. That's not gonna hurt anything, and they'll appreciate that. Have the patience that you learn to have when something catastrophic is what my son went through, you have to have. That's one of the biggest things, and it's really difficult. Nothing, once this happens, it's very hard.
So it sounds like you did a lot of rapport building, a lot of gratitude to those who did a good job.
If he was in the hospital, a week, 2 weeks, once he came home, I would send a basket of cookies, for the floor. And I think that this helped a lot with all the times that we had to go back to the hospital. Okay. Even with me, when I was discharged from the hospital, I sent them a cookie. It's just an appreciation, a thank you. There's a lot of us that are so overwhelmed with everything that we have to have, do, say, that sometimes you can't even keep up with it. And a lot of people might say, I don't have time for all that. Right. I get it. I totally get it. But that's how I was. That's how I am. I still am like that till this day, even with the rest of my family.
Now, if something didn't go so well, how did you effectively communicate that? Because a lot of people, I'll be honest, you're in a very vulnerable situation and you're hesitant to bring things up out of fear of retaliation, not then being ignored and not getting your needs met. So what are your tips for that?
There you have to skip everybody and go straight to the manager or the physician. You really do. And even then, explain to them what has happened and how it needs to get fixed. If at that point you see that it's not even, you don't feel the vibe there, you're gonna have to search for another physician. And a lot of times the easiest way to do that is by word of recommendation from other people that you have learned, you have met during this catastrophic situation, while at the hospital, while at therapy. Communicate with people around you. There's people that are, sometimes get so upset with everything quickly, but if you want to find out more information, who else can you get it from than the person right beside you?
Right, absolutely. It's that whole community network that makes it work. Right. So now, in your role as being in healthcare, you're on the phone. You've got somebody screaming at you because they can't get in until 3 weeks. What sort of tips do you have us as healthcare consumers on how to best interact with?
If your specialty, like we are, is it something that family practice can take care of quickly? Is it, in my case, the neurologist that can take care of it quickly? If I can't get that patient in, I discuss it with my physician to see what we need to do. Get her guidance, because I'm not the MD, but I understand, because you want everything taken care of like that quick, and you can't. So it's a matter of communication.
So I'm assuming that yelling at you does not help the situation,
No,
correct?
I let them, until they're done. And I'll say, ma'am, I totally understand where you're coming from. Sometimes I explain my situation, and that's me. You'd be amazed how they calm down, what I've gone through. And I can recommend, places that are there, people that are there, or feel free to call me anytime, kind of thing. And try to work it out that way.
So how to prepare for a doctor's appointment? First thing is you want to make sure that you arrive 30 minutes early at a minimum. Okay, do not show up late. Your physicians I know that sometimes they get backlogged, but if you are late, they're going to move on to the next person. Okay, so make sure that you get there early, and that includes, at this point, you might have to really figure out how to get transportation set up in order to make sure that you're there in time. Make sure you have your insurance card, your photo ID. You need to have a list of written questions, and you need to prioritize those questions. So if I'm going in to see my physician and this is why, I want to have my questions already prepared so that I am saving time. The physician can actually look at my questions, and that is also one of those things that will help save a little bit of time as far as, kind of going down the road this way or that way, but kind of keeping things right down the middle. You should have your updated medical and physician records. Again, your medical profile should be with you, and absolutely take in your medication list with all of the providers who have prescribed those medications for you. That is a must. All right, so we just talked about how to prepare for a doctor's visit, and kind of the questions you need to ask, and how to choose a friend or somebody to go with you, and then how to wrap up that appointment. Do you have any additional tips for us?
For wrapping it up, make sure that if someone's there with you, and it's such an overwhelming, especially the initial visit, have them write it down. Make sure that your medications are all refilled. If it's someone that was discharged from the hospital and this is their 2-week follow-up, with the new MD provider, have it written down, medications, if there's any referrals that need to be done. The hardest one is supplies. If you need supplies at home, make sure that the paperwork, let them know paperwork is going to come through the mail or through the fax. Please fill it out as soon as possible. That's one of the harder things for them to get their supplies. Okay, so the medical supplies, or getting the supplies, that information's faxed to the physician's office. The physician has to sign it off, yeah, because he's the one giving you the prescription,
right.
Or if you got it at the hospital.
Okay.
And that can be anything, chucks, the Depends, anything, tubes, whatever they might need.
Okay.
If you know that you left the hospital with those and you still need those, you need to get that prescription from him.
Okay.
If you have the information with you, that's even better. All they got to do is just fax it over there to the DME.
Okay. So it would be one of those good things to take with you,
exactly.
Right? Or if your appointment doesn't happen in that time frame, make sure you're in good communication,
right? And
get that sent over.
That's one of the hardest things, to make sure that those supplies get to the home in time.
Okay. If you are going to see a healthcare provider where you might be getting bad news, or it is for a specialty of some sort, you really should consider taking a friend. For your run-of-the-mill, go to see the PCP because you have a cold or even the flu. You don't necessarily need to take someone with you. But for everything else, I highly, highly recommend that you take a friend with you. And the reason for this is when we are faced with difficult situations, we can only take in so much information, okay? And even though we are sitting there and trying to diligently remember everything that's being said to us, as soon as we get some bad news, like, oh, you need to have an additional surgery, or this test result came back poorly, we may not hear the rest of the sentence, okay? So we want to make sure that there is someone there with us who can take notes and provide us that information. And if that person can't go with you, see if you can have them call in so they can at least hear what's going on, okay? So choosing someone to go with you to your appointments is also tricky. You want someone who's not going to take over and think that they're going to manage your health care. They need to be able to think objectively, okay? They need to be able to listen accurately. They need to be able to take notes. And more importantly, at the end of it, this is someone that needs to be able to reiterate that entire plan back to you and that healthcare provider to make sure that everything comes together, okay? You want to ask a lot of questions. So the what question? Ask for an explanation as to the diagnosis or the test. What do you need to do to prepare for a test or procedure? This is something that frequently kind of gets lost in the shuffle, but if you're going to have a procedure, very frequently they will ask you to stop taking medications that are blood thinners. So you need to listen carefully, because that does include things like even, fish oils, aspirins, and sometimes people don't stop to think about that. So make sure you are asking about the what. What do I need to do to prepare? Why do I have to have this test? Or why do I need to take this medication? The when is, when do you need to start taking this medication, and how soon or when do I have to have this test or procedure? The other thing that gets dropped a lot of times in the current state of kind of rushed healthcare is the who. Who is responsible for setting up the test or procedure? Very frequently, many times people leave the physician's office and the physician says, oh, I want you to have an MRI, and they say, okay, great, and they go and they check out, they pay their copay, and they leave thinking that this is going to be set up for them by the physician's office, when actually the patient has to set that up. So just make sure you're very clear about who is doing what, okay? Now, another when question, and this one's important, when will you hear back about the results of the test? Okay, never, ever assume that no news is good news. There are many times, unfortunately, where balls get dropped. And so we should have called you with this test result, and unfortunately we didn't. And now you're 6 weeks down the road. So please, if you don't hear, make sure that you are calling to follow up and say, what were the results of my test? Okay, again, remember you are a consumer, okay? And with that, it is okay to ask about cost. Do I have to have the MRI? Because I'm going to have to pay a lot out of pocket for that. Is it possible to go with something that's less, like maybe a CT or an ultrasound? Again, you defer back to what is absolutely needed for you, but it doesn't hurt to ask the questions, okay? Now, wrapping up the physician visit or your healthcare provider visit, at the end of your visit, you want to repeat back the plan of care to your provider so that you're clear that you have interpreted that correctly, okay? Do not leave an appointment until you know what to do next, all right? And then ask your healthcare provider for a written copy. Very frequently these days, they are giving you a written copy before you go out the door. If they are not doing that, most large systems are set up with a portal that you can go back in and check for a summary. Make sure that you go back and check that that summary is in there within a week of that. So we talked a little bit about cost already. I want to emphasize again, it is okay to shop around for a lower cost, okay? And it's not just necessarily, can I go with a cheaper procedure, a test, but it is also easier to stay in the same system, hands down. If I'm in a system, it's easier if that physician prescribes an MRI that I have my MRI done in that facility. It makes it much, much easier. However, tests that are provided in a hospital or physician office are typically more expensive than at an outpatient facility. So if you're on a tight budget and you have to think about a lot about the component of your payment that goes with that, those are things that you want to think about, okay? Make sure that your insurance considers the lab, the radiology center, anything else involved in that in-network. Unfortunately, there are still times where you have maybe a hospital that is in network, but you have a surgeon who's not, or you have a surgeon who's in network, vice versa. So those are things that you want to make sure that you're checking on, okay? And I absolutely get it. I mean, I've had many people say it's worth it for me to pay a little bit extra for the peace of mind knowing that it's all in the same system and I don't have to do more of the legwork, so to speak, on the back end. So just some things for you to think about. So things for you to consider after you receive your results. It is absolutely 100% okay to say, are you sure that that's the correct result? Could there have been an error? Okay, absolutely there could have been an error, okay? So ask, it's all right. You can ask, does my medical history, I'm feeling fantastic and great, and yet here you're giving me this really bad news and diagnosis. Does that seem to fit to you? It's okay to ask that question. You could also say, I get that this came back and looked okay, but I am still having this pain. What else do you think it could possibly be? All right. Is it maybe possible that I have more than one thing going on? Is it possible that I've got two things going on? Maybe I've got a kidney stone, but I'm also having, a respiratory infection. Is that possible? And you can always get a second opinion, always. And especially if there's something that is a serious diagnosis, I would actually say, yeah, it's time to go ahead and say, hey, let me just get a double check on this if there's no emergent rush, obviously. The other thing that you want to think about is your health literacy. So I want to be very clear that your health literacy has absolutely nothing to do with your level of intelligence. What it is your ability to understand healthcare information that is being presented to you, okay? So I've worked with individuals who have been attorneys and engineers who really don't understand the anatomy and the physiology that is going on behind their exam or their diagnoses. And I think the healthcare profession is sometimes we're very bad about saying, oh, it's your, instead of saying bend your knee, flex your knee. Well, not everybody knows what that means. So I think the onus is on the healthcare professional to use terms that you understand. We wouldn't expect, if I had an engineer who was talking, engineering stuff, I certainly would have no idea what that would mean, okay? I would have to ask questions and ask for clarification. So never hesitate to say that you're having difficulty understanding what they are telling you, and never pretend to understand, okay? Never, ever. Again, the onus is on the healthcare professional to make sure that they are relaying information to you in a way that you understand, okay? And if you think that there is an issue potentially from an understanding component from language, if you are in a larger facility or system, the majority of them have very good interpretive services, so do not hesitate to ask for that. You should ask for other healthcare provider intervention when it's maybe not offered right off the bat. So for example, a dietitian consult. If this is something you've just been recently diagnosed, say with diabetes, and you need to lose some weight, gosh, can I have a consult to see the dietitian to work on, one, what is a diabetic diet, and how can I change my eating habits, and what sort of a diet does that look like, okay? It may not be covered by your insurance, but you will not know until you ask. It doesn't hurt to ask, okay? Ask for therapy. Yeah, I'm having pain, and yep, I might have just gotten a prescription for medication, but what else can I do? Is it possible for me to go to therapy? Do you think that that would help my pain? Maybe you can ask if you've been suffering with pain for a long time. Pain management program, is that an option for you? Diabetic education. Did you ever get good diabetic education? What about cardiac rehab as well? So ask your physician and or your insurance company for a care manager, care coordinator, or a nurse navigator. Those are the frequently used terms. So if you do have to have surgery, it's important for you to figure out what surgeon you should go to, okay? You need to research. And while we all want someone who has a great bedside manner, the bottom line is you want a surgeon who has great outcomes and is very skilled at what they do, okay? So this is one of those things where you really, yes, it would be fantastic if they were nice and warm and fuzzy, but what's more important is what is their skill level, okay? And so you need to really research that. Once you have selected a surgeon, when you go in, the things you want to think about asking are, how many surgeries like this have you performed before? What are your outcomes when you have performed this surgery? What does my post-op protocol look like? What, do I have to be non-weight bearing for a while? Can I lift things? Am I going to be able to pick up and carry my kid? Can I drive? Am I going to have additional therapy? You want to know everything that's going to be required after that surgery in order to have a successful outcome, okay? And you want to know what the expected outcome is. Okay, so I'm having this surgery because, maybe an example, I'm having this surgery because I'm having pain. Can I expect my pain to be totally gone after I have had this surgery, or is it going to, you think at best, maybe decrease it by 50%? It's okay to ask those questions, okay? And then timing. How soon do I have to have this surgery, okay? Is this something that I need to do right away, or is this something that I could potentially put off for a month or two? Those are things that you want to make sure that you're asking about. So if you do end up in the hospital for any reason, whether it's an elective surgery or not necessarily elective, but something that you can plan on, or if something goes unfortunately wrong, you become ill and you are now admitted to the hospital again, you need to know your rights as a patient. You should not only be provided this in writing, but you should have it explained to you in a way that you can easily understand, okay? If you are in doubt about anything, ask for a timeout, okay? Hospital policies and procedures are in place for safety. However, sometimes it seems like there's a ridiculous level when I have been getting up to go to the bathroom on my own, and now they're saying I can't do that because hospital policy says I can't, okay? Ask the why, inquire about that, okay? Be clear with staff how much assistance you need. Okay, and this is really important for individuals who have had disabilities for a long time. You know best how you move, and I will assure you that unfortunately sometimes individuals working in hospitals are not maybe even familiar with someone who might have your particular sort of disability. So you will have to provide some type of education about this is how I do this. Please don't just lift me, give me some extra time, and this is what I'm going to be able to do, okay? If you do not feel your needs are being met or heard, contact the patient advocate right away, and they can help you have those kind of work through that. If you have to have surgery or on heavy doses of pain medications and you will essentially be incapacitated, you need to make sure you have somebody there with you at all times, okay? Don't hesitate to ask anyone who comes into the room, have they washed their hands? If you do not see them coming into your room doing this with, you know, the antibacterial hand soap or going over to the sink and washing their hands, it's okay to ask them, can you please wash your hands, okay? Everyone who enters your room should introduce themselves, tell you what they are there for. Are they a nurse? Are they a therapist? Are they a CNA? What is it that they are? And they need to tell you that up front, okay? They should also tell you what they will be doing, okay? And why they will be doing it. So they should also confirm who you are. Make sure that you are the correct patient. Double check medications when you are being given your medications, and ask for an explanation of each medication as it is being given to you. If it all comes in one big cup, I want to go over each one of those. What is this for? What is this for? What is this for? And remember, sometimes the medications that you might be getting in the hospital, it will be the same medication that you're getting at home, but it's a different, maybe a generic form, so it might look different, okay? So make sure you're getting clarification about that. And then as far as discharge planning, you want to make sure that you have a case manager or social worker working with you so that they can help you navigate that. If you are going to go home and you're really having a hard time getting into the front seat of a car, maybe can they help you figure out how to set up and get a van service where you can go in your wheelchair? Do you need to have therapy after surgery? Would be another example. So can they help you get set up with additional therapy, and what would that look like? Or equipment. You know, I'm going to be not able to put weight on my leg for a long time, 6 weeks, so I need something that I can shower on. So use them to help you get all of that. And then finally, make sure that you fully understand all of your discharge instructions, okay? What are my medications? When am I supposed to follow up? With whom am I supposed to follow up? Am I supposed to call them, or is it an appointment already scheduled? Okay. And then follow the instructions. I know that sounds silly, but we're all guilty of it at one time or another, right? If they say, these are the antibiotics and you take them for this many days, you need to make sure that you are taking those medications, the antibiotic, the way that they say, and even though I'm feeling great, I still need to finish that course of antibiotics, okay? And remember, there can be some serious consequences for stopping certain drugs cold turkey, okay? You can actually have withdrawals by stopping certain drugs cold turkey. So make sure you're well aware of medication interactions and how to follow those instructions. You know, if they tell you that you need to be non-weight bearing, you need to be non-weight bearing, okay? Don't put weight on that leg. Don't put weight on that leg. So just make sure you're following up all of those with all of that, and schedule up all those follow-up appointments as instructed. What recommendations do you have, or additional tips do you have for us about how to make that hospital stay go as smoothly as possible?
A lot of this stuff you have to write it down, because if you were on the neuro floor, but you're being admitted because, let's say, pneumonia, you're going on the medical floor, who don't have they learned it, but that's not their everyday routine. So my son, if I wasn't there, he'd tell them what they'd have to do. But on my note, I had on there how much saline, what other stuff they needed. Okay. Write it down. You've got to have it written down. And if you have to post it on that wall, you post it on that wall. I did. Mm-hmm.
No, that's
post it on that wall.
That's a great tip.
That's not the only patient for that nurse.
Right.
And it's not the nurse's fault. Mm-hmm. It's not their fault. You're just trying to make it easier for everybody pertaining to that room. Write it down, put it on the wall, step 1, step 2, step 3. Okay. And they'll do it. They will do it.
So now you're back at home and the bills start coming in. So you need to check all of your bills for errors. You would be surprised the number of errors that are on there. And if you see something that you're thinking, I don't know that I actually received this, don't hesitate to call your healthcare provider and say, hey, I think there's a billing error, and ask to have it corrected. You can also ask for an itemized bill where you can go line by line, okay? You need to learn how to read your what we call EOB, or explanation of benefits. And there's two good sites for that. One is verywell.com and also medicare.gov. So they help you kind of walk through that, because when you get these big stacks of explanation of benefits, it can be confusing about what is it that I owe, what is it that is being covered. Okay, so that helps clear some of that up. One of the other things that you can do, especially from a long-term standpoint, is identify additional resources, okay? Find out if you have a care manager, care coordinator, or nurse navigator through your insurance, and ask them to help get you linked up or set up with other resources. And if you're in a hospital, you can absolutely ask the case manager or the social worker to help you find these additional resources. Is there a national association that you can access for additional education and assistance? For example, United Spinal Association, American Diabetes Association, Heart Association, Stroke Association. Is there a local one, like United Spinal Houston, Association of Houston? So is there a local support group that you can join? Is there an online support group that you can join? Where can you get additional education and information about the current state of your healthcare? Other areas for additional resources that sometimes people don't think about are explore pharmaceutical assistance programs. If you are on medications that are extremely expensive, sometimes you can get grants through some of the pharmaceutical programs and save a lot of money. In addition, sometimes you can do this for other things, like if you have to have special nutritional supplements. So those are some of the things that you might be able to look at from that standpoint. Another great resource are your local nonprofits. Many of them can help you with things like equipment, sometimes transportation, with other things that would help decrease the burden overall, like food assistance, etc. So make sure you explore and look at your local nonprofits that could actually provide you some additional assistance. And finally, one of the things, if you say, do I need to go to the emergency room for, the reality is that probably you should have gone to the emergency room. So remember, if you have to ask that question, the answer is usually yes. If you have chest pain, if you have stroke symptoms, you need to call 911. Do not try to get to the hospital, just call 911 and have them come to you immediately. So while the healthcare system is tricky to navigate, I'm hoping that some of these tips will help give you a better idea about how to make that a little bit more manageable. And please share other ideas that you guys might have back with us, and we will do our best to be able to get those out one form or another, maybe even on our website or Facebook page. Thank you so much for being here and sharing all of your incredible wisdom. As I said, you've been through it all, and thank you for being willing to share that with all of us, so that it'll make all of our paths a little bit smoother and easier.
You're very, very welcome. Anything, sometimes just one word can help a family. It doesn't take to sit there and just talk about everything that's out there, but you got to listen to them. Listen to them. It's important, and they'll accomplish. It's something that it's all, as they tell us, baby steps. Well, thank you.
Thank you.